Oh, who's my physiatrist here? Ooh, one. Any physiatry? Okay, that, what does that look like? There used to be reflex sympathetic dystrophy. Yes. Now it's CRPS. So where do you think I injected that leg there? Pain is the distal manifestation of a proximal problem. This little girl, 10 years old, she's been hospitalized 4 times in and out of hospital. She's a little dramatic, a little whiny. I know she's got a lot of pain, but she's rather immature, so she wasn't helping those doctors in those hospitalizations figure out what she did. And it was pure trauma. They live on a farm. She bounces around, falls on her butt. She had a straddle injury. So what did we do? I did osteopathic treatment. She came in limping, wasn't using that leg on crutches. And on the first visit, she dropped that leg by 20%. So that means that the hip flexors relaxed by 20%. And then they had heard about me. They drive 3 hours for me. They had heard about me cleaning up somebody in 1 or 2 visits. So they came here, and I convinced them to let me do prolo. So they came in the next week, and we held her down. Where do you think I injected her? I actually wanted to do the hip, and I did do the hip. We held her down, did the hips, did some treatment. I came back, and then we held her down again, and we did the knee. Here we go. Ta-da. 3 visits, 2 prolos. Man, yep. So when the trophic effects return, I usually look for hair, I usually look for veins, but look at that position. So the contractures have melted, so I'm pretty happy with that. Let's see if we have, ooh, can I play the video on this? Can you tell me if I'm right? Are these fasciculations? She calls them the ghost in her leg, Shirley. That's why she calls them, that's why she calls it a ghost. It's doing things she can't control. So that was the first video before the first injection in the hip. And so I can tell you now there's less of that. She has more control. Do you notice the hair? Look at that one compared to the other one. Is that the syndrome component with the hair, or did the prolo there in the knee? No, this was before the injection, I think. Okay.